Ongoing weight loss in the setting of an advanced illness is a situation I frequently encounter in my patients. It can be very frustrating for patients, their families, and their medical team. Patients often ask me, am I starving? Would I live longer by eating more? Families often say, we must do something. We can't let them starve like that. Questions to be answered in this video. Are nutrient and supplemental feeding strategies beneficial in this setting? Are my patients actually starving? It's a tricky subject. Let's talk about it. Welcome to Palliative Care Explained, a channel aimed at answering your questions about palliative care. My name is Dr. Jonathan Wong, and I'm a palliative care doctor based out of Winnipeg, Canada. Please see the welcome video of this channel for my declaration that I do not have any conflicts of interest or any financial sponsors, and for the medical legal disclaimer statements. In part 1 of this series, I discussed the Anorexia-Cachexia syndrome and explained why patients with an advanced cancer or organ illness often experience a loss of appetite and unintentional weight loss. And in part 2, I discussed strategies and medications that may help increase one's appetite in this setting. If you haven't seen those videos, I encourage you to do so. I will leave a link in the description box below. Let's now talk about a situation I frequently encounter. Here, we have a patient who is living with an advanced cancer or an organ illness. Their appetite has been very poor, and they have lost a lot of weight. But they faithfully followed their dietitian's advice, and they took all of the suggested nutritional supplements. They also followed the suggestions I outlined in part 2 of this video series, and found some improvements in their appetite and intake. Unfortunately, this patient is still experiencing ongoing weight loss, despite eating more and taking all of these supplements. Patients often ask me, am I starving? How can I put some weight back on? Would I live longer by eating more? And their families often say, we must do something. We can't let them starve like that. At these times, I am frequently asked about the usefulness of more aggressive or invasive ways to get extra nutrients and calories into the body. This ranges from forced oral feeding to the use of feeding tubes and intravenous strategies. But in this setting of patients with an advanced cancer or organ illness, would supplemental nutrition and feeding strategies be beneficial? Is it worth it? Before answering this tricky question, though, we first need to define what beneficial means. And it can often mean different things to different people. In this context, though, I would say that many people wish to live longer, gain weight, live better with more energy, better strength and function, and to feel better and to have fewer symptoms. So, can adding extra nutrients and calories achieve these wishes? Unfortunately, no. Medical research and the evidence to date shows us that in patients with advanced cancers and illnesses, supplemental feeding strategies will not allow them to live longer, will not improve their weight in a sustainable way, will not improve their functional level, and will not reliably have a positive impact on their quality of life. And this is especially true as we get closer to end of life, where the prognosis is measured in a small number of weeks to months. Supplemental feeding strategies will also not cure or alter the course of the underlying illness. In this setting, unfortunately, these interventions are more likely to cause significant treatment burden and medical complications. For instance, forced oral feeding is physically uncomfortable for the patient and likely to result in increased nausea, vomiting, and upset stomach, as well as increasing the risk for aspiration and subsequent pneumonias. There is also the emotional effect that can come with the added pressure of being forced to eat. Tube feeding, known as enteral feeding, and intravenous strategies such as TPN or total parenteral nutrition can also create new problems, such as the discomfort and the increased risk of infection and bleeding associated with invasive feeding tubes and central IV lines. In other words, these strategies can actually cause more harm than benefit. Invasive supplemental feeding strategies can also potentially have a negative impact on a patient's psychological well-being. Emotions relating to the loss of control and the toll of being connected to machines, to name only a few. So please believe me when I say that this discouraging situation is frustrating for doctors and members of the healthcare team too. We too can feel helpless when we are unable to positively change the course of a patient's illness. Now, you may be thinking, this makes no sense. We are quite literally pouring and pumping nutrients and calories into a patient's body. How could that possibly not work? That's how we treat people who are starving. The answer to this question can be explained by what's happening to the body as a result of the Anorexia-Cachexia syndrome, a process that is physiologically very different compared to what's happening in starvation states and nutritional deficiencies. It might look like and feel like starvation, but it's a very different process. To briefly recap part 1 of this series, cachexia is the involuntary loss and wasting of muscle caused by the presence of an underlying medical illness, such as a cancer. As part of the Anorexia-Cachexia syndrome, the body becomes stuck in a breaking down mode and becomes much less able to extract and use the nutrients found in food and supplements to build itself back up. And this happens even when an abundance of nutrients is provided to the body. So how is that different than starvation, you may ask? You see, weight loss caused by starvation is caused by the inadequate intake of nutrients and calories. And in order to generate enough energy to survive, our body starts breaking down body fat to use as fuel. In most cases, weight loss from pure starvation can be fully reversed with proper feeding and nutrient supplementation. In contrast, weight loss caused by the Anorexia-Cachexia syndrome results from muscle breakdown caused by inflammation-inducing cytokines and other metabolic derangements. And this happens even with adequate nutrition. This form of weight loss is not sustainably reversible or improved upon by feeding strategies. And more often than not, the weight loss process continues, even in the presence of abundant nutrients. So key point, the most important distinguishing feature between starvation states and the Anorexia-Cachexia syndrome is weight loss from starvation gets better with nutrients and feeding. Weight loss caused by an advanced illness does not. As frustrating as it is, medical research to date has not found a reliable and sustainable way to shut off or reverse the Anorexia-Cachexia process. Once there are signs of cachexia, we do not have a good way to stop it. This is a part of the natural dying process. In this setting, my suggestion would be to let the patient determine their own pace of eating. Let the patient listen to their own body. The intention should be eating only for pleasure and not just for calories, and eating only the things that appeal to the patient. When the patient is full, the patient is full. There should be no further pressure to eat more. I realize, and I empathize, that this is much, much easier said than done. To summarize this video, though it can look like and feel like starvation, ongoing weight loss in the setting of an advanced illness is physiologically very different from that of starvation. Weight loss in the setting of an advanced illness is the result of the Anorexia-Cachexia syndrome and not simply from the lack of nutrients. As such, aggressive nutrient supplementation and feeding strategies are generally not beneficial to the patient and may actually be harmful, as medical research to date has shown that it does not have a significant impact on improving longevity, sustained weight gain, improved function, or improvement in a patient's quality of life. Thank you very much for watching this video. I hope to see you back for the next topic.